it's just so easy to lose that difficult 2-3 kilos just by being conscious of eating whole food. So what do you mean when you say that be conscious of eating whole food? What is it that we should be really aware of into what we put in our system?
Yeah. The answer to this won't be a very simple this and that, Rashmi. The thing is, what we lifestyle medicine physicians do is there is a shift from the earlier thing of the doctors saying, oh, you want this is what you have to do, and write a prescription and follow this. That's not how we will be working. So for us, it is about the patient being the center, and the patient is the driver. They decide what they want, and they decide how much of what is required they can do. We are there only as coaches who will walk along with them. And if they fall 2 steps back, we come back. So, and it's a very compassionate way of doing things. So the patient doesn't feel belittled or, feel, oh, I don't want to go. I'm scared, that doctor's going to now say, you didn't follow my. And say, it's not that way, because it's not about what the doctor wants. It's about what they want, what the patient wants. So that makes our job very easy, because they are the drivers. They decide what they want to do. They decide how much they want to do, and they decide where they want to start from. We can only give them, say, this is what you need to do. Tell me what it is that you are ready to do. And we see that one small change, they see that something which is very easy to do. If they can make that as a habit, then they will see, oh yeah, it is easy, it's not very difficult. And then they make this one change, and then they see the difference, and then we say, okay, you want to do a little more, is it possible for you to add another change? And then they will say, yes, I mean, if I could do this, that's become my habit, I will do that change. And before they know it, they have done all the changes, and they have done it on their own. We have only been showing how it can be done. So I tell my patients, you tell me what you want, I will show you how you.
I love that.
So it is they need to know what they want and why they want. That why is very important. Their why. Why am I going to, why do I want this? And if that becomes very clear, then the rest of the journey becomes easy.
So can you take us through a case study? Any patient of yours, of course, you don't need to name them, but something that set out as a challenge for you when you got on that journey, and it surprised you too, the way the things progressed and how the journey opened up?
I will tell you about my husband. For me, I can just decide on something and I'll do it. For me, it's like all or none. I do it or I don't do it. Nothing in between. So they make fun of me, Rashmi. They say, Mom, everybody is not like you. Everybody doesn't have the thing to say that, I'm not going to do, I'm not going to do. We are going to go up and down. And that is, I am seeing it with my clients and my people I interact with and all that. They say, oh, no, that's not possible by me. So one thing is, with my husband, like I said, we were 3 times a day non-vegetarian eaters, and just to shift was not easy. I, of course, decided I'm not going to. Of course, I also started because my daughter became a vegetarian. I became a vegetarian. And after 6 months, I decided that I'm going to go whole food, plant-based that way. For my husband, it wasn't so easy because he still craved for having a little bit of non-veg and sweets. He has such a sweet tooth that he couldn't refuse. So if he sees, he has to eat it. So then we decided, okay, most of the time, about 5 days in a week, we're going to have this whole food plant-based, and twice a week, when we go out or we entertaining people come home, we're going to have something that he likes. some non-vegetarian or something. So he feels happy. He doesn't get deprived. He doesn't feel deprived, that thing. So for his, that sweet tooth, for having that thing, he would have that. And he saw that it started making a remarkable change for his weight. His glycosylated hemoglobin, which was about in the borderline, like, we call it like pre-diabetic, although in Indian scenario, we don't have pre-diabetes, but by the Western literature, it is pre-diabetes. So it started coming down from 6.4, it has come to pre-diabetic just by doing these little changes. And that is when, you see, yes, it does make a difference. The second thing was with my father-in-law. Unfortunately, we lost him in 2023 October, but he was having very bad peripheral neuritis. I mean, he is, of course, a patient who almost didn't make it when he had his first heart attack at the age of 50. But thanks to a nurse who was there, who gave him that cardiac thump and revived him. And he has lived for 38 years post that, with, of course, 2-3 angioplasties and many other illnesses that he had to endure. He recovered from all of that, but his diabetes was really getting to him. He started developing wounds in his feet, and then he had what we call as peripheral neuritis, just pain in the legs, which started becoming very painful, especially in the nights. And he would really hold to his, and we felt so bad because we had done all the medical therapies, so called, to say, and he was on so many medications, but the wound also was becoming bad. In fact, the vascular surgeon said, if this is a thing, we may have to even amputate. Imagine, he is 88 years old, and an amputation is not going to go down easy with him. Plus, whether he's a candidate for, that surgery was something that was there. And that's when we decided that I said, no, I want to try. This is what I'm learning. I know that it makes a difference. And we could see the change. Predominantly plant-based diet, no non-vegetarian, minimal oil that he was using in his pain started coming down. His wounds started to heal. At the same time, you have guests in the house, somebody comes and, 2-3 days on end, he starts, having the non-veg and having the oily food and all that. You would see that he would be holding his leg at the end of the day, that it's hurting me, the pain is there. And then you get these blebs in these diabetic patients, they would start increasing in number, in size. And then once he goes back into this diet, they would again go down, his pain would come down. And Rashmi, he had some 7-8 wounds on his leg. A week before he died, all of them had healed. 1 week before, I told him, Mom, I don't have to do any more dressings. Otherwise, the past 4 years, every alternate day, sometimes every day, every other day, we had to do the dressing for him, for the wounds and all that. It was all clear, Rashmi. I like, for me, this was something that was happening in front of my eyes. And this is it, I said, I have all the proof that I need, and I need, I can tell it. I mean, there are other studies and journals and all the RCTs that are happening by the side, which we can quote, we can put it in our presentations and tell patients, but this was happening in front of my eyes. And I thought, I don't need to look any further. Yeah.